Fiona Phillips lives in the UK. For decades, she was a beloved fixture on a show called GMTV on British television, known for her warmth, wit, and candor. But behind the camera, her life was shaped by a private battle that would eventually become public: the slow, relentless encroachment of Alzheimer's disease. Her journey, chronicled in 2 memoirs, is not just a personal account, but a mirror for countless women navigating the uncertainties of midlife, memory, and meaning. I'm Dr. Manna, your friend and functional medicine doctor. I've been through burnout, breast cancer, and brain fog that felt like early-onset dementia. Now I'm passionate about guiding midlife women navigate perimenopause, menopause, and prevent dementia. Welcome to Dementia Decoded, an 8-part series inspired by the extraordinary story of Fiona Phillips, a courageous woman who worked as a morning show host on British TV for many years, as I said. This is part 1, Fiona's story. Fiona's story is in many ways the story of so many women. Both her parents were diagnosed with Alzheimer's disease, and she herself was diagnosed with early-onset Alzheimer's at the age of 61. Fiona is a really special woman. Her courage, her spunk, and her fierce devotion to her family and her work resonate with many women because we see ourselves in her. Her life and the lives of those she loved were upended by a disease that is often misunderstood, frequently misdiagnosed, and still shrouded in stigma and silence. And that's why this series matters. Because dementia doesn't just happen to old people. It happens to mothers and daughters, professionals and caregivers, women in the middle of everything. And too often, it starts with something we are told to brush off: brain fog, mood swings, forgetfulness, exhaustion. We blame menopause. We push through. But what if some of those early signs are whispers from a brain under stress? What if we could catch it earlier, change the course, or even reverse some of the damage? This isn't just about Fiona. It's about all of us. What we've been taught to ignore, what we still don't know, and what we can finally do if we pay attention. So if you're a woman navigating midlife, or if you love one, this series is for you. Because your brain deserves to be understood, and your future is worth protecting. The tragic story of Fiona's family started with her grandmother, who, in hindsight, Fiona reports had dementia-like symptoms, but of course there was no diagnosis and no treatment. Fiona's mother, Amy, was the heart of the family, chatty, giggly, and always ready with a meal and a laugh. But beneath her sunny exterior, Amy struggled with depression and anxiety. Fiona recalls that some of her earliest memories were of her mother having violent headaches, migraines, and shutting herself in a dark room. Were those related to her cycles or her periods? We don't know. This was when her mom was in her early 30s. Fiona was around 4 at the time, and she remembers hating those days because her mom wasn't in them. Throughout the 1960s, Amy, like many women of her generation, was often prescribed Valium, mother's little helper, to manage her anxiety and depression. Valium was used freely by doctors to literally tranquilize a whole generation of housewives in the 60s. Valium is a benzodiazepine. While benzodiazepines are still often prescribed for anxiety, sleep issues, or muscle tension, especially during midlife, long-term use may come with cognitive costs. Several studies have linked prolonged or high-dose use of benzodiazepines to an increased risk of dementia, particularly in older adults. The concern is that these medications dampen brain activity by enhancing a calming neurotransmitter called GABA, which can, over time, interfere with deep sleep and slow brain connectivity and processing. While a short course of benzodiazepines isn't necessarily harmful, chronic use has been linked to long-term cognitive concerns, especially in women who already face a higher risk for Alzheimer's. So, if you're using them regularly and starting to notice brain fog or memory lapses, it's a good idea to talk to your healthcare provider about safer, long-term ways to support your nervous system and protect your brain. Fiona mentions a traumatic event from her mother's teenage years, something that clearly left a mark. It makes me wonder, were there other adverse childhood experiences that quietly shaped her health over time? We now know that early life trauma doesn't just affect emotional well-being, it can have long-term effects on the brain and body, influencing stress response, inflammation, even brain aging. It's possible that those early wounds played a role, however indirectly, in the path that led to her mother's dementia. Amy had an exuberant exterior, but her inner world tells a more complicated story, one that's familiar to many women. She was a stay-at-home mother, married to a man who was always busy with work and didn't appear to offer much in the way of emotional connection. He wasn't cruel, just closed off, perhaps carrying his own unspoken disappointments. With few options and no real voice in the relationship, Amy eventually realized she needed something of her own. She tried different jobs until she found one where she could shine and earn a little money. But we have to ask, what's the long-term impact of spending decades in a marriage where your needs go unmet, your stress simmers quietly, and your sense of agency begins to erode? Chronic emotional suppression, social isolation, and lack of purpose are not just emotional wounds, they're biological stressors. They shape brain chemistry, fuel inflammation, and set the stage for possible future decline. For women especially, these invisible wounds can alter brain chemistry, increase inflammation, and who knows what will come later in life. By the time Amy entered her 50s, her personality had begun to shift. She became more withdrawn and sometimes irritable. Fiona understandably attributed these changes to menopause, stress, or simply the burdens of aging. Amy also underwent a poorly managed hysterectomy, something that left her physically depleted for a long time afterward. And she wasn't alone. In the 1970s, hysterectomy rates soared, especially in women in their 30s and 40s. It was one of the most common surgeries performed on women, often with minimal explanation and even less follow-up care. For many, it meant an abrupt loss of hormones, no discussion of hormone replacement, and years of feeling off without understanding why. We now know that surgical menopause, especially when it happens suddenly and without estrogen support, can accelerate brain aging and increase dementia risk. In Fiona's mother's case, that poorly managed hysterectomy may have been more than just a physical setback. It may have been one of the hidden, overlooked triggers in a long and quiet slide toward cognitive decline. It's important to know that Fiona's mother was prescribed hormone therapy, assuring her it would ease anxiety and depression. But what was the dosage and form, we don't know. We do know that it appeared to not have made a significant difference. Her symptoms persisted and got worse. Amy began to forget names, misplace items, and lose track of conversations. At Christmas, she wrote captions on photographs, misspelling words in ways that were uncharacteristic, or writing with a combination of small and capital letters. When Fiona would later see that, her stomach turned. Her mother had never struggled with spelling or writing before. Despite these signs, the family normalized each lapse. They looked at these incidents in isolation, never connecting the dots. How could they? Alzheimer's or dementia wasn't part of their consciousness at the time, even though one of Fiona's grandparents did have a dementia-like decline towards the end of their life. Fiona describes many events during her mother's 50s where she slowly descended into dementia. Her relationship with her husband had continued to deteriorate, and there didn't appear to be much communication between the two. There were times when she was lucid and like herself, but most of the time she was withdrawn and fearful. She was constantly writing things down in her notebook so she could have a way to keep track of things. She visited many doctors to try and figure out what was wrong with her. It wasn't until her early 60s that Fiona's mother was finally evaluated and diagnosed with Alzheimer's disease. When Fiona heard the diagnosis, she couldn't accept it. She didn't want to. She pushed back, insisting that her mother wasn't forgetful, she was just deeply depressed, the result of decades in an unhappy marriage with a distant husband. To Fiona, Alzheimer's was something that happened to old people. Her mother was still too young. Denial, in that moment, must have felt safer than facing the truth. What she may have not known then is that chronic depression, especially when left untreated for years, isn't just a symptom. It's a known risk for cognitive decline and Alzheimer's itself. Amy was started on a medication called Aricept or donepezil, a medication that is intended to slow the progression of Alzheimer's. It softened her decline briefly, but caused stomach cramping and didn't do much to lift her depression. Fiona describes the following 8 years as living without really living. Phone calls would arrive at 3 a.m. with her mother pleading, "Please help me." Fiona, raising 2 toddlers and hosting an early morning show on TV, felt the impossible burden of helplessness and guilt. Despite having 2 brothers and a father, Fiona became the default caregiver. We see this often. Adult daughters of parents with dementia often become the caregivers. This caregiving drained Fiona. Her work required her to wake up at 4 a.m. on weekdays. She would work all day, then come home and be a mom and a wife. And on weekends, instead of taking the time to unwind and relax, which she would have desperately needed, she would often drive 5 hours to go see her parents and help out in whatever ways she could. And this went on for years. Fiona's devotion to her mother never wavered, even as the weight of caregiving grew heavier with each passing year. She was raising young children, managing the relentless demands of a high-profile career, and quietly enduring the emotional exhaustion of watching her mother slowly disappear. Her father, whose behavior had grown increasingly strange, added another layer of complexity. All of this against the backdrop of 4 a.m. alarm calls, mounting fatigue, and the creeping fear that her own mind might be unraveling too. She describes feeling constantly knackered, a state that persisted not for months, but for 15 long years. Placing her mother in a care facility didn't bring relief. It brought a different kind of anguish. Her mother didn't want to be there, and Fiona knew it. Her father refused to visit, and Fiona would receive the distressing calls from her mother in the middle of the night. The guilt was relentless. She suffered and cried for years, Fiona recalls, always saying, "Please, please help me." And Fiona, despite all her love and effort, could do nothing to ease her mother's pain. What remained was an all-consuming sense of helplessness and despair, the kind that settles into your bones and doesn't let go. Fiona's experience is echoed by countless women who find themselves in the sandwich generation, caring for both parents and children while trying to maintain their own health and identity. The emotional and physical toll of caregiving is profound and too often invisible. When Amy died in 2006, Fiona was heartbroken. She said, "No one loves you the way your mother does, and when that love disappears, it leaves a space nothing else can fill." I understand that, I feel that, and I'm sure many of you do too. But instead of having the time to rest or care for herself, Fiona found herself facing yet another decline, this time in her father. The man who had seemed detached and aloof during her mother's illness was now showing unmistakable signs of memory loss. Looking back, Fiona came to realize that his emotional absence during her mother's final years wasn't just indifference, it was the early unraveling of his own mind. Her father's Alzheimer's progressed rapidly, but paradoxically, it seemed to lift his mood, at least in the beginning. Alzheimer's doesn't follow a single script. It reshapes each personality in its own unpredictable way. He laughed more, spoke less, but eventually needed to be moved to a care home a couple of hours away from Fiona. But even there, stability proved elusive. Fiona would receive calls that he had wandered off, and over time, his behavior turned agitated and violent. When the staff deemed him too distressing for other residents, his placement arrangement just collapsed. A turning point that so often signals the beginning of the end. He was transferred to a psychiatric hospital and immediately placed on a cocktail of powerful sedatives. By the time Fiona visited, he was unrecognizable. His eyes were vacant. Fiona says, in the space of a handful of days, they had stolen his soul. The medications didn't help, they merely subdued him, bloated his body, and turned his hair white almost overnight. Within weeks, he was gone. Fiona had lost both of her parents to Alzheimer's disease. In 2008, Fiona quit her beloved morning TV job. Her mother's illness and caregiving, in addition to her own busy life, had taken a giant toll on her. She began to feel something was off. Then she knew something was wrong. She felt her own memory slipping. She described the sensation vividly. Imagine wandering through a house you've never visited, looking for someone you love. You finally fit the key, open the door, then sense that person has disappeared again. The memory has gone, and I'm all alone. Fiona was still working, but not at the same pace as her previous regular job. But she knew something was wrong. Her brain did not seem to be working as usual. She was anxious, depressed, irritable, and at times apathetic. There are a couple of passages in her book that are so instructive on the commonalities between menopausal brain fog and early symptoms of memory loss, characteristics of Alzheimer's, that I'm going to simply quote her here. She says, "Menopause. It had to be the menopause. Suddenly everything made perfect sense. Why I'd been feeling so strange for so long. I spent hours reading up online about symptoms, and it all seemed to tally. Lack of concentration, sleeplessness, brain fog, feeling down and depressed. I had all of those things. That's what it had to be." Around this time, lots of women in the public eye like Davina McCall and Gabby Logan were discussing menopause in a way it had never been discussed before. It felt like all the pieces were falling into place. Why hadn't anyone told me before how debilitating the menopause could be? She goes on to say, "But I didn't have the hot flushes that a lot of women complain about. For me, it was the sense of brain fog and a sense of anxiety that I could rarely shake off. The brain fog had become increasingly common. I'd be halfway through a sentence and then forget what I'd been planning to say. Or I'd read a story in the newspaper in the morning and then be completely unable to remember what the point of it was." She continues, "I started making lists all the time. Shopping lists, to-do lists. If I was chatting to a friend or my agent on the phone, I would quickly write down what we had discussed in case it just disappeared and dropped out of my mind straight after." The other awful feeling, she says, was the aching anxiety that seemed to be with me so much of the time. Increasingly, things I'd done for decades, like turning up to a film, a program, made me feel sick with nerves. She says she kept pushing herself to do them as part of her was desperate for work, but the other part of her was terrified by the prospect of it. By her late 50s, Fiona could feel her own spark beginning to fade. Crowds unsettled her. The once joyful ritual of dinner at a favorite restaurant now filled her with dread. The worst symptom, she later wrote, was without doubt the brain fog. As I mentioned before, she told herself it was menopause, and internet forums seemed to agree. Anxiety, insomnia, trouble finding words, all classic signs of hormonal transition. Still somewhere in the back of her mind, her painful family history of Alzheimer's lingered, a quiet, knowing sense that maybe this was something more. She pushed the fear aside. Her husband, Martin Frizzell, noticed the shifts, mood swings, tears triggered by mundane errands. Friends chalked up to the change. In 2018, Fiona spoke candidly on television about menopause, even admitting she sometimes forgot names mid-sentence. Viewers nodded. Millions of women recognized that fog. But as she later wrote, fog doesn't fall all at once. There wasn't one overnight descent. It was more like a never-ending trudge down a tunnel, each step taking me further from the light. Sensing something deeper was wrong, Martin scheduled an appointment with Dr. Louise Newson, the UK's leading menopause expert. Fiona tried hormone therapy for a few months. When there was no improvement, Dr. Newson gently suggested it was time to consult a neurologist. By January 2022, Fiona was no longer able to keep up with her obligations at her part-time jobs. A neurologist ordered cognitive testing and plasma biomarkers. Fiona writes, "He said, 'Yes, so your results are back. And yes, I'm afraid to tell you that you do have early-onset Alzheimer's disease.'" She writes, "Martin and I stared at him. Neither of us said a word. Neither of us moved a muscle. The consultant's words hung in the air like some kind of nuclear dust. We sat rigid, locked in suspended animation between everything our lives had been before this moment and everything they would become beyond it. My heart was pounding, she says, and my head started to bang as if I could actually feel and hear the blood rushing through it. She says, this was all just too much. I'd known it was possible that this was what he was going to say, but as long there was one fraction of hope that he might tell us it was something else entirely, I was going to cling to it. Shortly after that, they made the diagnosis public. And in July 2025, with her husband Martin and a trusted editor, Fiona published her second book, Remember When, to shine a torch into dementia's darkness. There is a reason why I used Fiona's story to start this series on brain health and preventing dementia. Her timeline illustrates fundamental truths that every woman should know. Prodromal mood changes. Symptoms like depression, anxiety, migraines, and sleep disruption often precede measurable cognitive loss by years, even decades, especially in women whose symptoms are too easily labeled hormonal or menopausal. If you suspect something is off, share those concerns with your doctor. Do not delay. Ask for a blood-based biomarker test. Insurance may not cover it unless symptoms are advanced. If you can, consider paying out of pocket. Work with a doctor that knows how to prevent dementia and keep your brain healthy. Note, not all cases of dementia can be prevented, but majority can. It is up to you to take the action and work with a doctor to assess your risk. This thing about a diagnostic delay, it gets me so much because Amy's first unmistakable cognitive slips occurred decades before formal diagnosis. Early onset cases, defined as starting before age 65, can masquerade as burnout or menopause, leading to missed therapeutic windows. Handwriting changes, unusual spelling errors, needing notes to recall conversations, these are red flags. Don't dismiss them. Another thing to keep in mind is denial. Fiona had an unverbalized fear of getting Alzheimer's herself, and she let years go by without seeing a neurologist earlier. It's unclear if they ever explored preventive approaches. Dr. Bredesen, Drs. Sherzai, Dr. Ornish, and others have published their protocols, and results show clear outcomes of patients improving their brain health. Next, caregiver collapse. From the stress of caregiving and her own life, Fiona's immune system got so burnt out that she would get shingles, and she reports being chronically exhausted. This underscores that dementia is what we call a syndemic, affecting patient and caregiver physiology alike. Functional medicine frameworks insist we treat the ecosystem, not just the individual brain. And then there are multiple hits, like genetics, especially the ApoE4 gene, and I'll talk more about it in subsequent episodes, hormonal decline, chronic stress, sleep deprivation, environmental toxins, gut and metabolic health, and ultra-processed diets converge, creating vulnerability. For someone with the ApoE4 gene, alcohol is a known accelerant of risk. At multiple places, Fiona mentions that she started drinking early and that having a bottle of wine each over an evening of hanging out was not uncommon. Now we know more than one drink a day is known to be a risk factor for many diseases, including dementia. Knowledge of these risk factors allows one to be proactive about prevention and early intervention. Ignorance of these risk factors compounds risk. Next thing to keep in mind is the power of naming. Fiona's decision to reveal her diagnosis on national television was an act of courage. It has increased awareness and is a direct motivation and inspiration for this series that I've created for midlife women so they can educate themselves. It is spurring conversation about new diagnostics like blood-based labs and new therapies that I will discuss in subsequent episodes. So, looking ahead to what's next in the series, Fiona's story has set the stage for everything to come. So this was episode 1. In subsequent episodes, especially in number 2, I will discuss early versus late onset dementia, genes involved, timelines, and why women have greater risk of diagnosis. In episode 3, I will talk about modifiable and unmodifiable risk for dementia, including gender, genes, and on the other hand, on the modifiable side, toxins, insulin resistance, and other factors like sleep, etc. In episode 4, I will talk about the brain fog of menopause and the brain fog of the early stages of dementia, because this is a very, very important topic. In episode 5, I will talk about diagnostics, old and new, from pencil and paper tests to plasma p-tau 217. So all the conventional methods of diagnosing plus the latest tests that are on the market available today. In episode 6, we will talk about treatment methods, conventional and emerging therapies, cholinesterase inhibitors, memantine, and other protocols like Dr. Bredeson's protocol, Dr. Sherzai's protocol, and other newly emerging methods that are proving to be really effective. Episode 7 will be all about prevention with lifestyle medicine and genomics for personalized plans. And finally, episode 8 will be about caregiving without burnout, protecting 2 brains at once. Each episode stands alone, of course, yet together they paint a future in which more women keep their memories and their mothers and daughters longer. So if Fiona's journey echoes in your own life, don't walk this path alone. If this resonates, subscribe and share it with someone you love, because awareness is power and power can protect. Together, we can turn awareness into action and research into real-life resilience. Also, watch for my upcoming book on brain and hormone health for midlife women. Join my email list for deeper research briefs and practical checklists on brain and hormone health. I'm Dr. Manna, and this was episode 1 of Dementia Decoded, Fiona's story. I will see you in the second episode of Dementia Decoded on early versus late Alzheimer's.